Welcome back to the Short Coat Podcast, coming to you from the amazing and intense world of medical school at the University of Iowa Carver College of Medicine. I'm Dave Etler, and interacting with other people is hard. I know. We say things that come out badly. We think things we can't fully access, and then everybody ends up feeling like a dope. But are we a dope? Hard to tell, unless you post about it on Reddit. Here at Pass Judgment on Such Things is my squad. All M2s. Kate Timbo's here.
Hiya.
Samantha Gardner's here.
Hey.
Srishti Mathers here.
Hiya.
And Alexis Baker.
Hello.
Nice. You guys learn about trauma-informed care at all?
Yes.
A little bit.
Tell me something about that. Because I have a feeling in this question that we're going to listen to, I have a feeling that that's at play here and maybe should be thought about. What do you learn about trauma-informed care? What is it?
It's for everybody, not just people you suspect of having some sort of trauma in their life.
Mm-hmm. Yeah, important thing that I've learned about that is you don't need to predict like, oh, this person has trauma. You just do it the same way for everybody.
Mm-hmm.
You just assume trauma, I guess.
Mm-hmm. Just like taking the extra step to be mindful of how everyone has different experiences that you know nothing about.
Mm-hmm.
Yeah, and how those experiences can impact their mental and physical health, even if it's not like the most obvious thing.
Mm-hmm. Okay. Were you going to say something?
Really cool. I think Carver has just switched up their curriculum where we didn't learn about trauma-informed care until like the end of our M1 year. And they're changing it so that like all of their clinical and professional based skills are like based on trauma-informed care. So it's like the first thing that the M1's learned.
Love that.
So kind of cool.
That's nice.
Love that. Yeah. Well, one thing one thing I know about patients from being one on occasion is that the transition from, good old Dave Etler to really sick and injured patient Dave Etler can be kind of awful. It can mess with your identity. It can it's clearly doesn't feel good physically. And that can make people say and do things that they wouldn't otherwise. So here's a Redditor whose question, I think, begs the question, should traumatized patients be afforded some leniency when their behavior is bad, or should there be a hard line? Here we go.
The fertility clinic I own has a pretty huge wait list. Things have been a little hectic. One of the nurses, N, has been with the clinic since it opened. She is now 5 months pregnant. She preferred to take her maternity leave towards the end of the pregnancy. And we have a couple, Jen and Jack, who have been clients for a long time. Sadly, most of their treatments and IVFs ended in failure. A few months ago, she had a stillborn, and both of them were devastated. When the couple came in a few days ago, Jen saw N in the waiting room and started crying. After a few minutes, she started yelling at everyone about how insensitive we are. She yelled at N, and she said some very, very nasty stuff. End of the incident, we asked them to leave and dropped them as a client. The problem is that the waitlist these days are huge, and it's very likely that their treatment will be halted for a while. Jack called requesting us to put them back on the waitlist, but in the end, we were firm about our policies. Jack pretty much said the same as Jen in the end, that having a pregnant woman flaunting near women who are struggling with loss and struggling to conceive was an asshole move. Now, I am a little bit conflicted. It's not fair that some women have a lot of problems while others don't. However, it is pretty dumb to expect everyone working around infertility clinics to not work there if they are pregnant. Am I the asshole?
Okay, ready? We're going to pass our initial judgment. 3, 2, 1.
Really?
I don't know. I mean, look, I don't think that there's any way to I don't think that there's any way or that it's a good idea to be like, pregnant nurse, you can't work with these people because you're pregnant. That doesn't compute for me. I would like to have had a conversation with these patients and say, instead of just kicking them out, and say, this is my position here. If you can't handle it, I understand. It's time for you to go.
I sort of assumed that did happen in the incident.
I always like to try to approach these questions almost as literally as I can.
Literal. Okay. Well, I assumed that like in the build up, like they tried talking the person down.
Yeah.
And it just wasn't working.
That makes sense. I mean,
and then to have a repeat with the husband saying the same thing.
Yeah, you make a point.
Yeah, I think the repeat is where it gets damning. I also was a little bit like, maybe,
but they had already been suspended.
Maybe we just needed to have them leave and have a conversation a different day before suspension. Like, I'm not sure that trying to talk them down in the moment was ever going to get anywhere. And
which it sounds like they kind of did. Like she said, like they left and then we called them.
Okay.
And then like that's when the suspension happened, was like when they called them
after.
later. So I feel like maybe that
I didn't
was
get
something
that.
I thought they said that they left and suspended them.
Yeah.
And so
and then
thought it was all in
and then
one.
he called back.
Maybe
to
go.
back.
Yeah, and then he
misinterpreted
was like, the rules don't apply to me, and called back. And then like when he digs in, that solidifies their assholeness to me. 'Cause once you've had time to think about it, if you're still firmly on your own side, then not much help for you there. But I think immediate dismissal was maybe harsh.
I think that this couple needs therapy, first of all, to
Yeah.
talk through the emotions that they're going through.
They are in one of the worst possible positions that they can be in this case, or at least, even if it's not the case, I know that you can't, you're not supposed to really say, one trauma is worse than another trauma. I mean, it's all bad. So I do feel for this couple, but yeah, you can't really this idea of like women flaunting their pregnancy.
Yeah.
Like she's just, is she flaunting, or is she just
She just
existing as a
exists.
pregnant woman?
You can't guarantee to live in a pregnancy-free world. That's just not.
Right. Also, people who are going to the IVF clinic some of them are presumably getting pregnant, and so like
Sure.
I don't.
Yeah.
I hope so.
Those people are also probably going to come in for appointments pregnant, at least for the first bit.
Yeah.
So
You could have the pregnant waiting room and the non-pregnant waiting room.
That's
and you
crazy.
don't know if like
this is like a HIPAA violation.
Full crazy idea.
That's crazy.
I think also that
If you're visibly pregnant, you have to go to this room.
yeah,
If you're not yet visibly pregnant, you can go to this room.
I think like a bigger issue here is the verbal abuse of the healthcare staff.
Yes.
I think especially, bedside nursing already has a history of, patients being abusive towards them, and people like in power, like not really helping their staff. And so I feel like I kind of agree if you're going to abuse our staff. And they said, she didn't really say, or the OP didn't say what exactly was said, but they said very, very nasty stuff. It's like, so you're verbally abusing someone with very nasty language who is pregnant and is a worker there. I don't think you should. I don't think it's ever okay to abuse staff. And I think it's good that the administration stood up to protect their nursing staff.
The nurse in this case needs to be protected.
I was gonna say like you don't know if like this nurse had trouble,
Right.
becoming pregnant. Like it's just hard of like, she's flaunting her pregnancy.
Right.
Maybe this is something that she's been trying for a really long time. Maybe it's not. I don't know. Like that's also something to take into consideration. I do think it would have been like reasonable for the patients, like if like they were to have a conversation with the provider and be like, hey, like we just don't feel comfortable like having Nurse N or whatever they called her and thing, like to be the one that's like face to face working directly with us. Of like,
I mean, yeah, you can choose your providers.
Yeah.
like maybe if you have the staff to like request a different nurse, I think that would be reasonable. Like if this is something that's triggering for them,
But
like,
she's still
it's-
going to be
it's-
visible.
But
it's
that was
not
my waiting
appropriate
room.
to be like she can't be walking around the clinic because this is her job, and it's
Right.
like, I mean, you can't fire someone just because they're pregnant.
Yeah.
Right? So
Right.
that's
There's like laws about
there's like
that.
problematic.
Yeah.
So yeah.
Mm-hmm.
On Reddit, there's sometimes a third option that's ESH, everyone sucks here.
Mm.
And I'm like a little bit on everyone sucks here on this one. Same hard agree that you don't get to abuse staff, but they did say that they already have like a 3-year waiting list at their clinic and suspect that other people do too. So in the firing of this patient, they are perhaps deciding for this patient that, which again, the patient decided for themselves too when they abused staff. You don't get to be terrible, but they are now like solidifying the decision that this person may never become a parent. And that's kind of the catch-22 of being a healthcare provider and abuse, where no, you should never be abused, but in kicking somebody out, you're potentially deciding that that person is not receiving healthcare anymore, and that's a heavy burden to bear.
But then also, like, I fully agree, but then it's also like, if you did continue to keep this patient, like, how would that nurse feel? Like, that nurse would also probably feel like not supported at all in their workplace, and like now it's their fault that they're pregnant.
I think
Yeah.
I think as a professional, you could explain to her the other side of the situation and be like, look, I get it. They did not treat you well, and I'm not going to allow that. But here's the other side of that coin. I don't know.
Yeah.
But then where's the line?
But
Yeah.
right,
You know.
like how do you I
It's
think
hard
that-
without being there and seeing what happened.
Well, there
We're
is a-
all-
Like what was
because
the
we're all
escalation?
speculating
right.
on what happened,
Yeah.
but like I don't know that if she looked at her and called her like a cunt, that's really, really nasty. But is that you don't get to be pregnant ever level? Like
yeah.
I don't know.
Yeah,
I don't
yeah,
know
yeah,
that
yeah.
that's like you can fire somebody over that, and I don't know what their policy is, and I don't know what was said, and that's what makes it hard to like give a definitive. You're the asshole, you're not the asshole. I also think posting on Reddit kind of puts her into the asshole category.
There is an
One.
important piece of context that I left out for length of the actual quote, which is that this took place shortly after everything began opening up after COVID lockdown. And so that's why they were so busy, because many clinics were not yet open.
to
They were just
full-
starting to
yeah.
Yeah.
And that's why it was such a hectic time and why the wait lists were so long. I took it out for length, and now I'm kind of regretting it a little bit because it's, you know, it's a little bit of context. I don't know that it.
like hopefully with everything back to
Yeah.
or more up to capacity.
Like in normal circumstances.
Yeah.
Right.
They aren't. It's not essentially like a judge sentence of you are no longer having kids.
But at the time,
It would feel like
Nobody
it seems
knew-
like that. Yeah.
exactly what any of this meant.
Yeah.
So, and people were certainly stressed out.
Yeah.
Also know that, like, as a patient who is suffering, it's really hard to be
Rational,
rational.
especially
And-
in the case of a stillborn like
I
that.
mean, that's
Yeah.
That's
it's the worst.
the worst.
Or if you're in pain. I mean, these things sort of peck away at your rational sort of, and also your ability to be pleasant.
Yeah.
In your interactions with everybody. I mean, this is a highly charged situation. On the other hand, you learn more about people when things are bad than in the good times. So I don't know, maybe we learned something about this couple.
Yeah.
I would like to know
Go ahead. Oh.
if they had a track record of if it had built up to this and they had already kind of been icky, or if this was an isolated incident.
Right.
after
Like, is
their
there a strike
stress.
system or
Yeah,
is this
because
like,
is the like if this is an isolated incident and you're just like, I've never heard of a hospital or clinic having a like verbal assault you're one and done policy, so I think it's weird that they would get kicked out over one screaming match permanently.
That would be a pretty weird
so
piece of context to
this-
leave out of your Reddit question. 'cause
is
I-
this something that they've done multiple times and now this was the final straw, or is this like the first time they've ever done it and now you're gone forever?
And I imagine at least most people also at that clinic are also struggling, but they were able to not verbally abuse wait staff. So like earlier, like talking about it with someone, they obviously need to talk through this very emotional time with like a therapist or something and get to the underlying cause, because at the end of the day, everyone else has been able to, at least on the outside, manage their emotions, and being able to do that is how a society works.
Yes. We live in a society.
We do.
Well, Shortcuts, if you have something you want to say about any of this, if you disagree with us, if you love what we had to say, if you want us to say other things in future episodes, go to theshortcut.com/tell us and send us a message. Otherwise, that's our show. You guys, thank you so much for being here. Until next time, I'm Dave Etler saying, don't let the bastards get you down. Say bye, everyone.
Bye.
Bye.